Welcome back to Chilltalk English. Today, we have a topic that is useful, real, and honestly, a little uncomfortable.
But in a good way, like it helps you in real life. Today we're talking about going to the hospital or clinic and what to say in English when you feel sick.
We'll tell you a fresh story, teach key words, and then do simple conversation practice you can copy and use.
And don't worry, we'll keep it clear and friendly. If you can order coffee in English, you can do this too.
Let's start with the story. Listen for words like symptoms, check-in, and medicine.
Also, listen for how Mina explains her problem. She uses short, simple sentences. That's the secret.
So here's Mina's day.
Poor Mina.
Mina is a university student. She lives in a new city, and she's trying to be brave and independent.
She is also trying a lot of new food. That is important for the story.
Mina thinks, I'm fine. I'm young, I'm strong.
Famous last words.
The next morning, Mina wakes up and feels wrong. Her stomach feels tight, like it is twisting.
She sits up slowly and the room feels a little unstable, like the floor is moving.
She puts one hand on her stomach and thinks, okay, maybe I just need water.
She tries to stand, but she feels dizzy.
Mina walks to the kitchen. She takes one sip of water and suddenly she feels nauseous.
Nauseous means you feel like you might throw up.
Mina runs to the bathroom. She doesn't want to be dramatic, but her body says, nope. She throws up. Then, about 20 minutes later, she has diarrhea.
She sits on the bathroom floor and thinks, this is not a small problem. Also, she is alone. That part can feel scary.
Mina texts Leo. She types very slowly because her hands feel weak.
The message is simple. I'm really sick. Can you help me?
Leo calls right away. Mina answers with a weak voice.
Leo says, do you want me to take you to a clinic?
Mina says, yes, I think I need a doctor.
10 minutes later, Leo arrives with a bottle of water and a very worried face.
Mina opens the door. She looks pale. She is wearing the same pajamas and her hair is messy.
Leo says, okay, no shame. We've all had a sick day.
Mina tries to laugh, but she doesn't have the energy. She just nods.
On the way to the clinic, Mina holds a small plastic bag, just in case.
Leo drives carefully. He doesn't talk too much. He just says calm things like, we'll get you help, and breathe slowly.
That's a good friend.
They arrive at a walk-in clinic connected to a bigger hospital.
Mina walks in slowly. The lights feel too bright. The smell is clean, like soap and hand sanitizer.
At the front, there is a check-in desk. A receptionist looks up and smiles politely.
The receptionist says, hi, how can I help you today?
Mina speaks quietly. I feel very sick. I have stomach pain and I'm vomiting.
She also adds, and diarrhea. She looks embarrassed when she says it.
The receptionist stays professional. Okay, let's get you checked in.
The receptionist asks for her name and date of birth.
Mina answers. Then he asks, do you have an ID?
Mina gives her ID card.
He hands her a form. Please fill this out. Write your symptoms and when they started.
Mina looks at the paper and thinks, my brain is not working today.
Leo helps her. He points to the boxes and reads them out loud.
Mina writes slowly, stomach cramps, vomiting, diarrhea, dizziness. Started this morning.
She also writes one more important thing. I think I'm dehydrated.
Dehydrated means your body doesn't have enough water.
They sit in the waiting area.
Mina leans forward with her elbows on her knees. She tries to breathe through her mouth.
Leo says, "Do you want me to ask for a trash can?"
Mina whispers, "Yes, please."
After a short wait, a nurse opens a door and calls, "Mina on?"
Mina stands up carefully. Leo stands too, but the nurse says, "Only the patient, please."
Leo gives her a thumbs up. Mina walks in.
Inside, the nurse is kind and calm. She says, "Hi, Mina. I'm Nurse Patel. Come with me."
Mina sits in a small room. The nurse closes the door for privacy.
Nurse Patel says, "First, I'll check your vital signs."
Vital signs are basic health numbers like temperature, blood pressure, and heart rate.
The nurse takes Mina's temperature. Then she wraps a cuff around Mina's arm to check blood pressure.
She also clips a small sensor on Mina's finger.
Mina asks, "What is that?"
Nurse Patel says, "It checks your oxygen level. It's quick."
Then the nurse asks, "Can you tell me your symptoms?"
Mina takes a breath. "I have stomach cramps. I threw up 3 times. I also have diarrhea. I feel dizzy."
Nurse Patel nods and types notes into a computer.
The nurse asks, "When did it start?"
Mina says, "This morning, after I woke up."
The nurse asks, "Did you eat anything unusual yesterday?"
Mina says, "I ate street food at a night market. It was spicy."
The nurse asks, "Do you have a fever?"
Mina says, "I don't think so."
Nurse Patel asks one more important question. "Do you have any allergies to medicine?"
Mina says, "No, not that I know of."
The nurse asks, "Are you taking any medication right now, even vitamins?"
Mina says, "Just a basic multivitamin."
Then Nurse Patel says, "On a scale of 0 to 10, how bad is your pain?"
Mina looks confused.
Nurse Patel explains, 0 is no pain. 10 is the worst pain you can imagine.
Mina thinks for a moment. Maybe a 6.
Nurse Patel says, "Thank you. That helps."
The nurse gives Mina a small cup of water, but she says only a little sip for now.
Mina takes a tiny sip. She keeps it down, but she still feels weak.
Nurse Patel says, "A doctor will see you soon."
A few minutes later, the doctor enters.
He smiles and says, "Hi, Mina. I'm Dr. Chen."
Dr. Chen sits down, so he is at Mina's eye level. That feels respectful and calm.
Dr. Chen says, "I read your notes. Tell me in your own words what's happening."
Mina says, "My stomach hurts. I'm vomiting and having diarrhea. I feel dizzy and I feel very tired."
Dr. Chen asks, "Any blood in your vomit or stool?" Mina's eyes go wide. "No." Dr. Chen nods. "Good."
He asks, "Any chest pain? Trouble breathing?" Mina says, "No." He asks, "Are you pregnant?"
Mina says no. Then he says, "Okay, I'm going to examine your abdomen." Abdomen is a more formal word for your stomach area.
Dr. Chen gently presses different parts of her belly. "Tell me if this hurts." Mina says, "That spot hurts a little."
Dr. Chen listens with a stethoscope and checks for tenderness.
Then he says, This looks like acute gastroenteritis. That's a long term, but the simple meaning is a stomach infection.
Dr. Chen adds, it can be caused by a virus or by bad food.
Mina says, so food poisoning?
Dr. Chen says, it could be. Either way, the main problem right now is dehydration.
Mina says, I feel like I have no energy.
Dr. Chen says, that makes sense. You've lost a lot of fluids.
He explains, I recommend IV fluids to rehydrate you faster. We can also give you medicine for nausea.
Mina asks, is an IV the needle in your arm? Dr. Chen says, yes, a small needle, then a tube. It's common and safe.
Mina looks nervous. Dr. Chen says, we'll do it gently, and you can tell us if you feel faint.
Mina takes a breath. Okay, let's do it.
Nurse Patel returns with the IV supplies.
Mina looks away.
Nurse Patel says, you're doing great. Small pinch.
Mina feels the pinch. Then it's done.
The fluid starts to drip into her vein.
Mina lies back on the chair. It's not a bed, but it's comfortable enough.
After about 15 minutes, her face looks less pale.
She says, I feel a little better.
Nurse Patel smiles. Good, that's what we want.
Dr. Chen comes back later to check on her.
He asks, any more vomiting?
Mina says, no, not since I got here.
He says, great, your blood pressure is improving.
Then Dr. Chen gives clear instructions.
He says, for the next 24 hours, focus on fluids.
Small sips, he adds, water, oral rehydration solution, clear soup.
Mina asks, can I eat?
Dr. Chen says, start with simple food, bananas, rice, toast, plain noodles. Avoid spicy or oily food.
He also says, no alcohol, no energy drinks.
Mina whispers, I wasn't planning on it.
Dr. Chen continues, if you get a high fever, severe pain, or blood, come back right away.
Mina nods. Okay.
He says, I'll give you anti-nausea medicine and electrolyte powder.
Electrolytes are minerals your body needs, especially when you lose fluids.
After the IV finishes, Nurse Patel removes it and puts a small bandage on Mina's arm.
She hands Mina a paper with discharge instructions.
Discharge means you can leave and go home.
Nurse Patel says, read this at home. It explains the dosage.
Dosage means how much medicine to take and how often.
Mina asks, can I go back to class tomorrow?
Nurse Patel says, if you feel better, maybe, but rest is best.
Mina says, rest sounds perfect.
Mina walks slowly. Leo stands up the moment he sees her.
He says, how are you?
Mina says, not amazing, but better. They gave me fluids.
Leo says, good. Let's get you home.
At home, Mina drinks small sips of water and eats plain toast.
She sends Leo a message. Thank you for helping me today.
Leo replies, anytime. Next time, we share one spicy noodle bowl, okay?
Mina writes back, next time we eat boring food.
And that's the story.
Okay, now let's turn it into English you can use.
We'll teach P vocabulary first.
And we'll keep the meanings simple with examples.
Word 1, nauseous. It means you feel like you might throw up.
Example, I feel nauseous when I smell strong food.
Word 2, dizzy. It means you feel like the room is spinning or you might fall.
Example, I stood up too fast and got dizzy.
Word 3. Symptoms. These are signs that you are sick.
Example, my symptoms are a sore throat and a cough.
Word 4. Check in. It means you tell the front desk your name and your problem.
Example, I need to check in at the clinic.
Word 5. Vital signs. These are basic health measurements.
Example, the nurse checked my vital signs.
Word 6. Dehydrated. It means your body needs more water.
Example, after vomiting, I felt dehydrated.
Word 7. IV fluids. That is liquid that goes into your body through a vein.
Example, they gave me IV fluids to help me rehydrate.
Word 8. Prescription. That is a doctor's order for medicine.
Example, the doctor gave me a prescription for nausea medicine.
Word 9. Dosage. That is how much medicine you take and how often.
Example, the dosage is 1 pill twice a day.
Word 10. Discharge instructions. That is the paper that tells you what to do after you leave.
Example, I followed the discharge instructions and rested at home.
Now let's practice useful clinic phrases.
First, phrases you can say at the front desk.
Hi, I don't feel well.
I need to see a doctor.
I have stomach pain and nausea.
My symptoms started this morning.
Now, phrases you can say to the nurse or doctor.
I threw up 3 times.
I have diarrhea.
I feel dizzy and weak.
I think I'm dehydrated.
I'm not allergic to any medicine.
Now, phrases medical staff might say to you.
Please fill out this form.
I'm going to check your temperature.
On a scale of 0 to 10, how bad is your pain?
We'll give you fluids.
Please rest and drink plenty of water.
Let's do a mini role play. You can listen first, then copy us.
I'll be the nurse first. Henry will be the patient.
Hi, I need help. I feel really sick.
Okay, what symptoms do you have?
I have stomach cramps and I feel nauseous.
When did it start?
It started this morning.
Do you have any allergies to medicine?
No, I don't.
Okay, I'm going to check your vital signs.
Now we switch. I'm the nurse.
And I'm the patient.
What brings you in today?
I've been vomiting and I have diarrhea.
Are you able to drink water?
Only small sips. I feel dizzy.
Okay, we may give you IV fluids to help you rehydrate.
Thank you. I just want to feel normal again.
Nice! Now it's time for shadowing practice.
Shadowing means you repeat right after us and copy the rhythm.
Repeat after me. I don't feel well.
Repeat after me. I feel nauseous.
Repeat after me. I have stomach cramps.
Repeat after me. I've been vomiting since this morning.
Repeat after me. I have diarrhea.
Repeat after me. I feel dizzy and weak.
Repeat after me. I think I'm dehydrated.
Repeat after me. Do I have any allergies? Not that I know of.
Repeat after me. What is the dosage?
Repeat after me. Thank you for your help.
Great. Now we'll tell the story one more time, a little faster, like natural conversation.
Try to catch the key words. Then you can retell it in your own words.
Mina ate spicy street food at a night market, and the next morning she woke up feeling awful.
She had stomach cramps, vomiting, diarrhea, and dizziness, so she asked her friend Leo for help.
Leo drove her to a walk-in clinic, and she checked in at the front desk and filled out a symptom form.
A nurse took her to a room, checked her vital signs, and asked about allergies and when the symptoms started.
The doctor examined her abdomen and said it was likely a stomach infection or food poisoning.
Because she was dehydrated, they gave her IV fluids and medicine for nausea.
After a while, she felt better, and the doctor gave her discharge instructions: drink fluids, eat simple foods, and come back if she got worse.
Then Leo took her home, and Mina promised herself she would be more careful with spicy food.
If you learned even one useful phrase today, that's a win.
And if you can say, I feel nauseous with confidence, you are officially prepared for real life.
Thanks for spending time with Chill Talk English. Keep practicing, keep it simple, and we'll see you next time.